it is rather fake news to say COVID-19 vaccine will harm anybody and because it's foreign. Which other vaccine do we produce in Nigeria? Everybody here, most of you have children. Your children must go and take what we call the childhood immunization, BCG, oral polio, DPT, that is diphtheria, pertussis, and so on, and then even the Movilox, influenza, and so on. All these vaccines, are we producing them here? Are we taking them, giving them to our children? Why are we not having fear to say that that will be contaminated? Why wouldn't those ones have been used to kill us more? If you have to travel, you take yellow fever. We used to produce yellow fever here, but we don't produce as much, but we still take it. If you don't have yellow fever card, you don't take yellow fever, you won't travel. So why is that not used to kill? So the answer is first and foremost so that you disseminate. As scientists, we have said this several times. Nobody will deliberately go and put something to kill somebody. The process of manufacturing, the process of approval is transparent. But besides, our more critical and important is that as a country, that is why we have regulatory bodies. Vaccines that are being used here, when they came in, they didn't just take it and start giving to people. Our own regulatory agencies tested it, verified it, and saw that it is safe, and that's why we started giving. In addition, there's continuous monitoring to be able to see what effect it will have. And there's not been any report of even any what we call adverse effect. Adverse effect is what is not normally seen, which can happen as all of us here, we are all different. So the ordinary Panadol, what we call ordinary Panadol, somebody can take it and can react to it in a very bad way. As a practitioner, I've seen people that died from taking Panadol from adverse reaction. So does that mean that Panadol will not be taken by all again? No. So talk less this one, so far, there's not been any report. So I'm emphasizing that so that the media will use this opportunity to tell Nigerians that the vaccine is safe. Let us not follow all those fake news. And there are politics in terms of the fake news of the news. From foreign, not from Nigeria alone. Because people are putting politics into it. You can know in America because of their politicking and so on. The COVID-19 response or the COVID-19 pandemic exposes to even the other policymakers, like as you saw several times, the Secretary of Government of Relations lamenting that he wasn't aware the kind of deficit we have in our IT infrastructure. So we will be able to use the opportunity of COVID-19 to improve on that infrastructure, using the instrumentality of our statutory function of appropriation. At least if we have similar outbreak now, like for example, when COVID-19 broke out, we had only 2 labs that could do molecular lab testing. As we speak now, we have more than 90 labs, both private and public. And in terms of public, every federal government-owned institution, 52 of them, they all now have a molecular lab. They all have isolation center, which can accommodate minimum of 30 beds, and they all have ICU of 10 beds with all the functionalities, using the instrumentalities of the financing that we'll be able to get. But in addition to that, there's always been a lot of capacity building and so on.